So the facility to make available for these surgeries, can state government participate in this and help you out?
Now, I think this is the need of the hour because, as you have seen, there are so many patients who are requiring a liver transplant. Certainly, government facilities have to develop liver transplant facilities. Some hospitals have already done so in different aspects. So, there are two ways of doing this. One is obviously providing financial support, like for example in DDSY or PMJ, for patients who actually travel so that they can get their liver transplants in reputed facilities. The second is to develop in-house facilities. So this requires certain infrastructure, it requires equipment. More importantly, it requires a very dedicated team. So in this day and age, because there is a lot of skill available in India, there are lots of good teams available in India, it's very critical that governments tie up with teams that are already doing transplant so that we can develop these services safely within the government sector.
So any further plans to work with Goa government or something like the approach?
No, we are obviously very happy to work with every government. Our mandate is to make sure that no person who has a liver disease is denied treatment. Whether it's happening in public or private, it doesn't matter. Eventually, treatment is what is important. And certainly when you are developing services in the government, then many more people can benefit.
Dr. Sonal Asthana is a world famous liver transplant doctor. In Goa, we have lots of cases which have been developing of fatty liver, and a lot of liver transplants are required, especially in pediatric cases. Now, Dr. Asthana is a specialist in this type of activities. He is a sought after doctor not only in India but also in Europe and other places. You remember when we had no bypass surgeon in Goa, especially heart bypass surgeon in Goa. The problem was all the people had to rush to either Karnataka or Maharashtra. Similarly, today people have to rush either to Karnataka or Maharashtra or Mumbai, and proper treatment is not available. And that is the reason why we thought of inviting Dr. Sonal Asthana, who was willing to be a part of the team to be set up in Goa so that the Goans especially get this treatment at hand and in the town itself. And more important is, this type of activity needs special training. The team has to be prepared. So our students will also get, medical students will also get an enlightenment in the area of liver transplant and liver treatment. So this is the precise reason why we thought that Dr. Sonal Asthana would be very, very important for this tiny state of Goa.
Subscribe Prudent social media channel and press bell icon for latest notifications.